we'll now look at some specific joints of the body. Some of the ones that people injure the most, the ones that have the most detail. Um, these are the joints that actually represent a lot of the stuff that we've talked about in the previous videos. So we'll start with the knee joint. The knee is a large, complicated joint. It's basically a bunch of joints together. So there is the patellofemoral joint, or the femoropatellar joint. It's a plane joint. It allows gliding motion while the knee is flexed of the kneecap. Then there are the tibiofemoral joints. There's one on the lateral side and one on the medial side. And these are condylar joints. And they have something else called a meniscus. All of these things work together to actually end up being a modified hinge joint. The movements that are allowed in the joint are flexion, extension, and a little bit of rotation to lock and unlock the joint. So when we look at it, the joint is stabilized by ligaments. There is the femur here, the tibia here. The fibula doesn't play a role in the knee joint. The patella does. It's here. The synovial cavity is all of this space here, and it ends up being continuous with something called the suprapatellar bursa. It's here, the synovial membrane extends and the capsule extends up here to A, allow full flexion of the knee, and B, to act as a bursa between the quadriceps tendon and the patella when the knee is extended. There's an infrabursa patella here, or infrapatellar bursa here, that prevents friction. There's another prepatellar bursa here that stops friction when you're kneeling. There are these wedge-shaped bits of fibrocartilage, and they're called the meniscus. There's one on the medial side and one on the lateral side, and they actually create the cup that the condyles sit in. They're more flexible and they're more mobile than if it was made out of bone. And then the ligaments cross the joint here and hold it together. So when we look down from the top, we will see that there's two menisci. These are these C-shaped fibrocartilage rings. The lateral meniscus is very tightly, is almost circular. It's very tightly C-shaped, and the medial meniscus is a much kind of more open C. It's less circular. The meniscus is held into place by some fibrous connective tissue here that holds the two of them together and holds them in place on the tibia. The femoral condyles work with that. So there are a lot of bursa, as I pointed out. There is almost no joint capsule, and what capsular is very loose because there's a large range of motion here. There are very strong muscles that cross this joint and give it its stability. So when we look at it here, we can see that there are large muscles and tendons that help stabilize the joint. We call the collateral ligament on the lateral side the fibular collateral because it goes from the femur down to the head of the fibula, and it's extracapsular. On the medial side, there's a medial collateral ligament or a tibial collateral ligament that joins the femur to the tibia, and it is intrinsic. It's part of the capsule. These retinaculum are really kind of tendon slips off the quadriceps muscle, and they help reinforce the front. Right? Inside, there are some cruciate ligaments, and they prevent hyperextension. They prevent the movement when the knee is flexed or extended of the femur on the tibia in an anterior posterior direction. So from the back, it ends up looking like this. It seems like a bit of a mess, but the ligaments make sense. So this one is oblique popliteal ligament. This is the popliteal region, and it runs obliquely. There's the articular capsule here. These are tendons of the various muscles, the calf muscles, the hamstring muscles here. There's one that arcs here, so that's called the arcuate ligament. Inside the joint, this is the lateral condyle. This is the medial condyle sitting in the meniscus here. There's a ligament that runs from the front of the tibia in between the menisci to the lateral side of the space between the two condyles. So it's actually kind of it runs up, back, and laterally to be on the medial side of the lateral condyle. The posterior cruciate ligament runs from the posterior part of the tibia up, forward, and medially to insert on the lateral side of the medial condyle. And these two ligaments end up crossing. So when the knee is flexed, the posterior cruciate ligament is tight and prevents the knee from slipping. When the knee is extended, the anterior cruciate ligament tightens and prevents the knee from slipping. Common injury is when the knee is extended, the anterior cruciate ligament is tight, and if you're hit from the outside, then the medial collateral ligament and the anterior cruciate ligament get torn.